welcome to my vlog on skills versus capacities in the weight room. First up, squats. In all weight room activities, the technical model is key as it increases efficiency and reduces the risk of injuries. Limitations in the technical model are generally either skill-based or capacity-based. Looking at the athlete shown here, you can see that his movement seems to be limited, specifically with his left ankle dorsiflexion, his increased trunk flexion, and his increased left weight bearing. As we observe his squat in slow motion, we can see his increased left weight bearing, as shown in the still, where there is a 5-degree difference between sides. Increased weight bearing on his left side leads me to consider whether there is a weakness on his right side, leading to a adaptation to change his weight bearing increased on the left, or another limitation elsewhere. As we move on in this analysis of squats, we can clearly see from this posterior view that the left heel lifts from the floor and the left foot in its entirety slowly deviates outwards. This could be due to a restriction in the hip, therefore allowing an increased range of motion to occur in the hip, or to compensate for a lack of dorsiflexion in the left ankle. With this in mind, I wanted to check dorsiflexion in both ankles to rule this in or out as a contributing factor to this limitation. Using a kneeling knee-to-wall test was most appropriate in this case, as knee and hip are in similar positions to the deepest part of his squat. Also during this, a history was taken revealing historical left ankle and hip fractures, and there was also a noticeable leg length discrepancy of approximately 1 inch. The reduction in dorsiflexion on the left side can be seen in the testing, as there's a noticeable and a significant difference versus the right. This is also shown in the two stills with their respective angles on each ankle. To summarise the limitations, there's a reduction in left dorsiflexion, an increase in trunk flexion, and also an increase in left weight bearing. To rectify these limitations in the short term, bilateral heel raises were used. This improved the symmetry of the squat, but did not remedy all of the limitations, such as the forward trunk lean. This was likely due to the leg length discrepancy. Therefore, a single heel wedge was used under the left heel. This had a much more marked effect on his technique, improving all of the limitations previously seen, his symmetry, also the depth of his squat, and his trunk position. Due to all these factors and his medical history, as well as his previous training history as a pro rugby player trained in Olympic lifting, I conclude that this is more of a capacity limitation than skill limitation. In contrast, the next athlete has never completed a squat with a bar, which makes me think about her skill level. In the analysis, I look at just the major technical faults. The first and most important, in my opinion, is the lack of hip hinge to initiate the squat. She initiates her squat instead with her knees driving forwards. Her trunk and tibia are not parallel, her chest and gaze point down, which all leads to a loss of a natural lordosis in the lumbar spine. Finally, her thighs do not reach parallel, indicating a lack of good squat depth for this athlete. These three major technical faults all lead to their own problems. Decrease in the hip hinge leads to an increase in load on the anterior aspect of the knees. The poor trunk position can lead to an increased load of the spine and the spinal musculature, as well as reducing the mechanical ability to bear load through the spine. The decreased depth leads to reduced hamstring and gluteal activity, therefore leading to an increase in quad dominant squat. The stills on screen emphasise a lack of consistency with this athlete and her squats. Due to so many deficiencies, I wanted to check if strength was part of this limitation. This next clip shows that she can leg press 60 kilograms. Her body weight is 53 kgs and the bar being used is approximately 7 kgs. Therefore, strength is not a limiting factor. Coaching was the next area to consider. So with some intrinsic and extrinsic cueing, I look to improve this athlete's squats. I focused on 3 main cues on the 3 main faults within the technical model. To ensure that hip hinge was the first initiation, I placed a seat slightly out of the reach of the athlete for her to reach her hips back towards. Once the athlete was competent with that, I talked about pulling the bar around you to ensure there was some thoracic extension. And finally, I talked about looking straight ahead. This ensured that her head and gaze remained upright. You'll notice with this that she was lacking consistency with her squats. When she did one element well, for instance the hip hinge, she tended to lose her head and torso position. There was often lots of repetition of these cues. Although her tibial and torso positions improved, these were not very marked. Her gaze, head and spinal positions, however, did markedly improve. Depth of her squat was very similar to her pre-coaching squat. Her improvements in this skill with limited coaching, her lack of familiarity with the skill, the strength and mobility as a Pilates instructor, as well as her inconsistency with the movement, that she shows a skill limitation. Next up, I'll be looking at the bench press. This athlete maintains good bar position and appropriate elbow flexion in the deepest part of the movement. However, there is a lack of full right elbow extension, and as we look at his bench press with an increased load, this lack of extension becomes more noticeable. We also notice an asymmetrical grip of the bar, which is likely a compensation for this. With the dumbbell press, the decreased stability in the right arm is marked. This athlete has a good training history with the bench press and 18 months ago had a double spiral fracture to his right humerus. He can achieve full range of motion without load, however other capacities are lacking. Cues were not significant enough input to improve the limitations with this athlete. I did cue him to push his hands all the way to the ceiling and to address his grip position. With these deviations from the technical model, I believe that there is a capacity limitation in this athlete. This is potentially a strength-based capacity issue with some elements of mobility. Looking at loading his elbow more revealed that there was certainly a strength limitation. With some assistance, he is able to complete a good-looking dip. However, without any assistance, he deviates significantly onto his left arm. In comparison to these capacity limitations, this next athlete shows significant skill limitations in my opinion. Her training history doesn't include any weight room activities and she has never done a bench press. Although she is likely to also have some capacity limitations, I believe that these are not as significant as the skill ones. The previous male athlete shows good technique with an unloaded bar, where she shows multiple faults. The bar dropping to the left and being close to her chin are two of the most obvious ones. She gets good full range of motion at her elbows at the top of the press, unlike the male. She also has asymmetries at the elbows and shoulders at the bottom of the press. Increasing the load does not significantly alter these limitations, with similar bar angle, similar elbow angles at the bottom of the press as well. This does give me more cause to believe this is a skill limitation as opposed to a capacity limitation. Another key limitation to this bench press is that the bar doesn't get low enough towards the chest. There's also a decrease in consistency with this increase in load. Providing some feedback from both myself and the recording, this athlete was able to improve her technique, resulting in a more efficient movement with less risk of short or long-term injuries. Again, when learning a new skill, consistency can be an issue which is demonstrated well here. Two of the key limitations, bar and elbow angle, will both improve significantly. This can be seen in the comparison stills. We also looked at a dumbbell press to assess stability in this movement. The athlete commented that this was a more challenging exercise than with the bar, and it is noticeably less controlled within this recording. Another aspect that I wanted to assess was her strength. As can be seen from the half press ups, she has a significantly more strength than is required to press the 15-kilogram bar. This is another element that leads me to conclude that this was more of a skill-based limitation as opposed to a capacity-based. To summarise, of the two athletes with capacity limitations, the squat improved with the outside constraint of a heel raise. However, long term, I do not believe that this capacity will change. The bench press was limited by a strength capacity that will improve with training after the fractured humerus. The two athletes with skill limitations both improved with different types of cueing, both intrinsic, extrinsic, as well as video feedback. And with practice, I believe both these athletes will continue to improve. Thank you very much for watching.